Question 1. Comparative studies suggest that understanding the specific physiological pathways a medication targets is crucial for predicting patient responses. When administering a new medication to a patient, which of the following best reflects a CMA/CMT's understanding of its mechanism of action and its implications for patient care? Option A. Recognizing that the medication's mechanism of action directly influences its therapeutic effects and potential side effects, necessitating monitoring for expected outcomes and adverse reactions. Option B. Attributing any changes in the patient's condition solely to their pre-existing medical diagnosis, without considering the medication's impact. Option C. Believing that common side effects are minor and do not require specific attention or reporting unless they are severe. Option D. Focusing solely on the prescribed dosage and administration schedule, assuming the supervising nurse has addressed all potential patient responses. The correct answer is A. Recognizing that the medication's mechanism of action directly influences its therapeutic effects and potential side effects, necessitating monitoring for expected outcomes and adverse reactions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified medication aide/technician, CMA/CMT, to go beyond simply administering medication and delve into understanding the underlying physiological processes affected by those medications. The challenge lies in accurately assessing patient responses and potential adverse effects, which necessitates a foundational knowledge of pharmacodynamics and pharmacokinetics. Misinterpreting a patient's reaction due to a lack of understanding of a drug's mechanism of action can lead to delayed or inappropriate interventions, potentially compromising patient safety and well-being. This requires careful judgment to differentiate expected therapeutic effects from concerning adverse reactions. Correct approach analysis. The correct approach, which involves recognizing that a specific medication's mechanism of action directly influences its therapeutic effect and potential side effects, represents best professional practice. This aligns with the regulatory framework for CMAs/CMTs, which mandates that they possess a comprehensive understanding of the medications they administer. This understanding is crucial for safe and effective medication management. For instance, knowing that a beta blocker works by blocking the effects of adrenaline on the heart and blood vessel mechanism of action allows the CMA/CMT to anticipate and monitor for bradycardia or hypotension as expected side effects, and to differentiate these from more serious, unrelated issues. This knowledge empowers the CMA/CMT to provide accurate patient education and to report significant deviations from expected responses to the supervising nurse promptly, fulfilling their ethical and regulatory responsibilities. Incorrect approaches analysis. Focusing solely on the prescribed dosage and administration time without understanding the drug's mechanism of action is a regulatory and ethical failure. This approach treats medication administration as a rote task rather than a clinical responsibility. It fails to equip the CMA/CMT to anticipate or recognize potential adverse drug reactions that are directly linked to how the drug interacts with the body. For example, administering a diuretic without understanding that it increases urine output by inhibiting sodium reabsorption in the kidneys could lead to a failure to monitor for dehydration or electrolyte imbalances, which are direct consequences of its mechanism of action. Attributing all patient changes to the underlying medical condition without considering the medication's influence is another significant failure. This demonstrates a lack of understanding of pharmacodynamics, the study of how drugs affect the body. A CMA/CMT is expected to recognize that medications are designed to alter physiological processes. If a patient's condition changes, the CMA/CMT must consider whether this change is a direct result of the medication's intended or unintended effects. For instance, if a patient on an anticoagulant develops bruising, attributing this solely to their underlying condition without considering the anticoagulant's mechanism of action, inhibiting clotting factors, is a critical oversight. Assuming that all side effects are rare and unlikely, and therefore not requiring specific monitoring, is a dangerous and ethically unsound practice. Regulatory guidelines for CMAs/CMTs emphasize vigilance and the reporting of any untoward effects. While severe side effects may be rare, common side effects are often directly related to the drug's mechanism of action and require monitoring. For example, a patient taking a medication that affects the central nervous system might experience drowsiness as a common side effect. A CMA/CMT who dismisses this because it's common might fail to recognize if the drowsiness is becoming excessive and impacting the patient's safety, such as increasing the risk of falls. Professional reasoning. Professionals should approach medication administration with a clinical mindset, not just a procedural one. This involves a continuous learning process where understanding the why behind a medication's use is as important as the how and when. When administering any medication, a CMA/CMT should ask, what is this medication intended to do in the body, mechanism of action? What are the expected therapeutic effects? What are the common and serious potential side effects, and how are they related to the mechanism of action? What specific patient parameters should I monitor before, during, and after administration? This proactive approach, grounded in understanding mechanisms of action, allows for early detection of issues, effective communication with the healthcare team, and ultimately, safer patient care. Question 2. The audit findings indicate a discrepancy in the documentation related to a resident's diuretic medication. As a certified medication aide/technician, what is the most appropriate initial course of action to address this finding, considering the drug classification? Option A. Immediately adjust the diuretic dosage on the medication administration record to what you believe is a more appropriate level based on your understanding of diuretics. Option B. Ignore the audit finding, assuming it is a minor clerical error that will not impact the resident's care. Option C. Document that the resident is no longer receiving the diuretic, as the audit suggests a problem with its administration. Option D. Verify the resident's current medication administration record against the physician's orders, paying close attention to the dosage, frequency, and route of administration for the diuretic. The correct answer is D. Verify the resident's current medication administration record against the physician's orders, paying close attention to the dosage, frequency, and route of administration for the diuretic. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified medication aide/technician, CMA/CMT, to interpret and act upon audit findings that suggest a potential deviation from proper medication administration protocols. The challenge lies in discerning the root cause of the discrepancy and determining the most appropriate corrective action without overstepping professional boundaries or making assumptions that could compromise resident safety or facility compliance. It necessitates a thorough understanding of drug classifications and their implications for administration and documentation. Correct approach analysis. The correct approach involves a systematic review of the specific medication, its classification, and the resident's current orders. Understanding that a diuretic is a drug that increases urine production is fundamental. If the audit indicates a discrepancy in documentation related to a diuretic, the CMA/CMT must verify the resident's current medication administration record, MAR, against the physician's orders. This includes checking the dosage, frequency, and route of administration. If the MAR reflects the physician's orders accurately, the next step is to investigate potential documentation errors or omissions that may have triggered the audit finding. This approach upholds best professional practice by prioritizing resident safety through accurate medication management and adherence to physician's orders, which is a core tenet of CMA/CMT practice, as outlined in state regulations governing medication administration. It also demonstrates a commitment to quality assurance and continuous improvement by addressing audit findings proactively and thoroughly. Incorrect approaches analysis. One incorrect approach would be to immediately assume the physician made an error and to adjust the medication dosage or frequency without direct physician consultation. This is a significant regulatory and ethical failure. CMA/CMTs are authorized to administer medications as prescribed, not to independently alter dosages or schedules, regardless of their understanding of drug classifications. Such an action constitutes practicing medicine without a license and directly violates regulations that define the scope of practice for a CMA/CMT. Another incorrect approach would be to dismiss the audit finding as a minor clerical error without further investigation. This is professionally unacceptable because it neglects a potential indicator of a systemic issue or a resident safety concern. Failing to investigate audit findings related to medication administration can lead to continued noncompliance, potential harm to residents, and a breach of the CMA/CMT's ethical responsibility to ensure accurate and safe medication practices. Regulations typically mandate that all audit findings be addressed and resolved. A third incorrect approach would be to focus solely on the documentation aspect without considering the resident's current status or the medication's classification. While documentation is crucial, understanding that a diuretic's effect is tied to fluid balance is important. If the audit finding relates to a diuretic, and the CMA/CMT only reviews the MAR without considering if the resident is experiencing any related side effects, or if the medication is still indicated based on their current condition, they are not fully addressing the potential implications of the audit finding. This oversight can lead to missed opportunities to identify potential resident harm or to advocate for necessary changes in the care plan. Professional reasoning. When faced with audit findings, a professional CMA/CMT should employ a structured decision-making process. This begins with understanding the specific finding and the medication involved. Next, they must consult the primary source of truth, the resident's current physician's orders and the MAR. If the MAR aligns with the orders, the focus shifts to identifying any documentation discrepancies or potential errors. If there is a discrepancy, or if the finding suggests a potential issue with the medication's appropriateness or administration, the next critical step is to communicate with the supervising nurse or physician. This collaborative approach ensures that any necessary adjustments are made within the appropriate scope of practice and in consultation with licensed healthcare professionals, thereby safeguarding resident well-being and maintaining regulatory compliance. Question 3. To address the challenge of a resident reporting new-onset chest tightness and shortness of breath who has a history of anxiety, what is the most appropriate initial action for a certified medication aide/technician, CMA/CMT, to take? Option A. Administer the resident's PRN anxiety medication as ordered for anxious feelings. Option B. Advise the resident that these symptoms are likely due to their anxiety and encourage deep breathing exercises. Option C. Observe the resident for any further changes in condition, check vital signs, and document all findings before contacting the nurse. Option D. Immediately contact the resident's physician to report the symptoms. Correct answer is C. Observe the resident for any further changes in condition, check vital signs, and document all findings before contacting the nurse. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified medication aide/technician, CMA/CMT, to interpret subtle changes in a resident's condition and determine the appropriate level of intervention. The resident's history of anxiety adds a layer of complexity, as it can be difficult to distinguish between a genuine physical symptom and a manifestation of anxiety. The CMA/CMT must balance the resident's comfort and autonomy with the imperative to ensure their safety and well-being, adhering strictly to established protocols and the scope of practice. Correct approach analysis. The correct approach, which involves observing the resident for further changes, checking vital signs, and documenting findings before contacting the nurse, represents best professional practice. This aligns with regulatory frameworks for CMAs/CMTs that emphasize systematic assessment and reporting. Specifically, it adheres to guidelines that mandate observation and data collection as the initial steps in patient monitoring. This approach ensures that the nurse receives comprehensive and objective information, enabling an informed clinical decision. It respects the CMA/CMT's role in data gathering and preliminary assessment, without overstepping their scope of practice by making independent medical judgments or administering PRN medications without explicit direction. Incorrect approaches analysis. One incorrect approach would be to immediately administer a PRN anxiety medication. This is a regulatory failure because CMAs/CMTs typically do not have the authority to independently administer PRN medications for new or changing symptoms without a specific order from a licensed nurse or physician for that particular symptom presentation. It also bypasses the essential step of assessing the resident's current physical status, potentially masking a more serious underlying condition. Ethically, it prioritizes symptom management over a thorough assessment, which could compromise patient safety. Another incorrect approach would be to dismiss the resident's complaint as solely anxiety without further assessment. This is a failure to adhere to professional standards of care, which require all reported symptoms to be taken seriously and investigated. It demonstrates a lack of thoroughness and could lead to a misdiagnosis of a physical ailment. Ethically, it disrespects the resident's experience and could lead to inadequate care. A third incorrect approach would be to immediately call the physician without first gathering objective data and consulting the nurse. While physician notification is sometimes necessary, it is usually a step taken after initial assessment and consultation with the supervising nurse, who can then triage the situation appropriately. This approach bypasses the established chain of command and may result in unnecessary physician intervention or a delay in appropriate nursing assessment. It fails to utilize the full scope of the CMA/CMT's role in preliminary assessment and reporting. Professional reasoning. Professionals should employ a systematic decision-making process that begins with active listening and observation. This is followed by objective data collection, e.g., vital signs and thorough documentation. The next step is to communicate these findings to the appropriate supervisor, the nurse, for further evaluation and direction. This process ensures that patient care is evidence-based, safe, and within the defined scope of practice for the CMA/CMT, while also respecting the resident's reported symptoms and the expertise of licensed nursing staff. Question 4. The audit findings indicate a discrepancy between a physician's written order for a specific antibiotic and the medication available on the medication card, which is a different antibiotic but appears to be for a similar condition. What is the most appropriate and legally compliant course of action for the certified medication aide/technician, CMA/CMT? Option A. Administer the medication that is available on the card, assuming the physician intended to order it for the patient's condition. Option B. Administer the available medication, but make a note in the patient's chart that a different antibiotic was given than what was ordered. Option C. Administer a different antibiotic from the medication card that the CMA/CMT believes is a suitable substitute for the prescribed medication. Option D. Contact the prescribing physician or the designated licensed nurse to clarify the order and obtain a corrected prescription before administering any medication. The correct answer is A. Administer the medication that is available on the card, assuming the physician intended to order it for the patient's condition. Explanation. Scenario analysis. This scenario presents a common challenge in medication administration where a discrepancy is noted between a physician's order and the medication available. The certified medication aide/technician, CMA/CMT, is faced with a situation that requires immediate attention to patient safety while adhering to strict regulatory protocols. The challenge lies in balancing the urgency of providing medication with the absolute necessity of ensuring the correct medication, dosage, and route are administered, as dictated by state and federal regulations. Failure to follow proper procedure can lead to medication errors, patient harm, and regulatory noncompliance. Correct approach analysis. The correct approach involves immediately ceasing medication administration and consulting the prescribing physician or the designated licensed nurse. This aligns directly with federal regulations, e.g., Centers for Medicare and Medicaid Services (CMS) guidelines for medication administration in long-term care facilities, and state-specific nurse practice acts and CMA/CMT scope of practice law. These regulations mandate that medication errors must be prevented and reported, and that any discrepancies in orders must be clarified before administration. The CMA/CMT's role is to administer medications as ordered, not to interpret or alter orders. Escalating the issue to the physician or nurse ensures that the order is verified, corrected if necessary, and that the patient receives the appropriate medication safely. This upholds the principle of patient safety and adherence to the 5 rights of medication administration: right patient, right drug, right dose, right route, right time, with the added critical step of right documentation and right reason. Incorrect approaches analysis. One incorrect approach is to administer the medication as it is available, assuming the physician intended the available medication. This is a direct violation of federal and state regulations that require strict adherence to physicians' orders. It bypasses the verification process, increasing the risk of administering the wrong drug or dosage, which can lead to adverse patient outcomes and constitutes a serious breach of professional responsibility and regulatory compliance. Another incorrect approach is to administer a different medication that the CMA/CMT believes is a suitable substitute. This is a critical failure as it involves the CMA/CMT practicing beyond their scope of practice, which is strictly defined by state law. Only licensed healthcare professionals with the authority to prescribe or adjust medication orders, physicians, nurse practitioners, physician assistants, can make such decisions. The CMA/CMT is not authorized to make clinical judgments about medication substitution, and doing so exposes the patient to significant risk and violates regulatory frameworks governing medication administration. A third incorrect approach is to ignore the discrepancy and proceed with administration, hoping it will not be noticed or cause harm. This demonstrates a severe lack of professional judgment and a disregard for patient safety and regulatory requirements. Federal and state regulations emphasize the importance of accurate medication administration and reporting of errors or near misses. Ignoring a known discrepancy is negligent and can have severe legal and ethical consequences, including patient harm and disciplinary action against the CMA/CMT. Professional reasoning. When faced with a discrepancy in a medication order, a CMA/CMT should follow a clear, systematic decision-making process rooted in regulatory compliance and patient safety. First, pause and identify the discrepancy. Second, consult the physician's order and the medication label carefully. Third, immediately cease any attempt at administration. Fourth, escalate the issue to the appropriate authority, typically the prescribing physician or the supervising licensed nurse, to obtain clarification and a corrected order. Fifth, document the discrepancy and the resolution according to facility policy and regulatory requirements. This structured approach ensures that patient safety is paramount and that all actions are compliant with governing laws and guidelines. Question 5. The performance metrics show a slight increase in the time taken to administer medications when a known patient allergy is documented for a prescribed drug. A CMA/CMT is preparing to administer a new antibiotic to a patient with a documented allergy to penicillin. The physician's order is for amoxicillin, a penicillin-based antibiotic. What is the most appropriate immediate action for the CMA/CMT? Option A. Administer a different antibiotic that the CMA/CMT believes is a safer alternative, without consulting the physician. Option B. Administer the amoxicillin as ordered, assuming the physician is aware of the allergy and has determined it is safe. Option C. Inform the patient that they cannot receive the amoxicillin due to their allergy and refuse to administer it without further consultation. Option D. Immediately contact the prescribing physician or supervising nurse to report the allergy and the potential contraindication before administering the medication. The correct answer is D. Immediately contact the prescribing physician or supervising nurse to report the allergy and the potential contraindication before administering the medication. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a physician's order and a known patient allergy. The certified medication aide/technician, CMA/CMT, is in a position of direct patient care and is the last line of defense before a potentially harmful medication is administered. The challenge lies in navigating the hierarchy of authority, ensuring patient safety, and adhering to established protocols without overstepping professional boundaries or causing undue delay in necessary care. The CMA/CMT must exercise critical judgment, relying on their training and understanding of drug allergies and contraindications. Correct approach analysis. The correct approach involves immediately verifying the allergy information and communicating the discrepancy to the prescribing physician or the supervising nurse. This aligns with the core ethical and regulatory responsibilities of a CMA/CMT, which prioritize patient safety above all else. Regulations for CMA/CMTs typically mandate that they report any suspected errors or contraindications to the appropriate personnel before administering medication. This ensures that the physician or nurse can review the order, confirm the allergy status, and make an informed decision about the medication, potentially revising the order or selecting an alternative. This process upholds the principle of do no harm and ensures adherence to facility policies and state regulations governing medication administration. Incorrect approaches analysis. One incorrect approach is to administer the medication as ordered without questioning it, assuming the physician is aware of all patient information. This is a critical failure to adhere to safety protocols and regulatory requirements. CMA/CMTs are trained to identify potential medication errors, including those related to allergies. Failing to report a known allergy is a direct violation of their duty of care and could lead to a severe adverse drug reaction, constituting professional negligence and a breach of regulatory standards. Another incorrect approach is to refuse to administer the medication and inform the patient directly that they cannot receive it, without escalating the issue to the physician or nurse. While the intention might be to protect the patient, this bypasses the established chain of command and the physician's ultimate responsibility for the medical order. CMA/CMTs are not authorized to independently alter or refuse physician orders without proper consultation and verification. This could lead to a delay in necessary treatment if the allergy is not a true contraindication, or if an alternative medication is readily available and appropriate. It also fails to involve the licensed professional who can make the final clinical decision. A third incorrect approach is to administer a different medication than ordered, believing it to be a safer alternative due to the allergy. This is a significant overstep of the CMA/CMT scope of practice. CMA/CMTs are authorized to administer medications as prescribed, not to make independent clinical judgments about therapeutic substitutions. Such an action bypasses physician oversight and could result in administering an inappropriate or ineffective medication, leading to patient harm and violating regulatory mandates regarding medication administration. Professional reasoning. When faced with a potential medication error, especially one involving a known allergy, a CMA/CMT should follow a structured decision-making process. 1. Recognize the potential discrepancy. Identify the conflict between the physician's order and the patient's known allergy. 2. Verify information. Double-check the patient's chart or medication administration record for accurate allergy documentation. 3. Immediate reporting. Promptly and clearly communicate the concern to the prescribing physician or the supervising nurse. 4. Await clarification/correction. Do not administer the medication until the discrepancy is resolved by the physician or nurse. 5. Document the event. Record the communication, the physician/nurse's response, and the final action taken. This systematic approach ensures patient safety, maintains professional accountability, and adheres to regulatory requirements. Question 6. The risk matrix shows a high probability of exposure when handling certain chemotherapy agents, and a recent incident involved a minor spill of such a medication during preparation. The CMA/CMT is aware of the spill and the potential for airborne particles. The patient is waiting for this critical medication. What is the most appropriate immediate action? Option A. Attempt to clean up the spill quickly using readily available cleaning supplies and gloves before administering the medication. Option B. Proceed with administering the medication to the waiting patient, as the spill was minor and the patient's need is urgent. Option C. Immediately stop the administration process, secure the area, and report the spill to the supervisor or designated safety officer for proper cleanup and assessment according to facility policy. Option D. Inform the patient about the spill and ask if they are comfortable proceeding with the administration despite the incident. The correct answer is C. Immediately stop the administration process, secure the area, and report the spill to the supervisor or designated safety officer for proper cleanup and assessment according to facility policy. Explanation. This scenario presents a professional challenge because it requires the certified medication aide/technician, CMA/CMT, to balance the immediate need to administer a critical medication with the inherent risks associated with handling hazardous substances. The CMA/CMT must prioritize patient safety and their own well-being while adhering to strict protocols. Careful judgment is required to assess the situation, identify potential risks, and select the most appropriate course of action that aligns with regulatory mandates and ethical obligations. The correct approach represents best professional practice because it demonstrates a commitment to safety and compliance. By immediately stopping the administration and reporting the incident, the CMA/CMT is following established protocols for handling hazardous medication spills. This action ensures that the spill is addressed by trained personnel, minimizing exposure risks to themselves and others, and preventing potential contamination. This aligns with regulatory guidelines that mandate specific procedures for managing hazardous drug exposures and spills, emphasizing containment, cleanup, and reporting to prevent adverse events and ensure proper documentation. An incorrect approach that involves attempting to clean the spill without proper personal protective equipment, PPE, and without reporting it is professionally unacceptable. This failure violates regulatory requirements for handling hazardous medications, which mandate the use of appropriate PPE to protect the healthcare worker. It also constitutes an ethical failure by potentially exposing others to the hazardous substance, and by neglecting the duty to report an incident that could have broader implications for facility safety and patient care. Another incorrect approach, such as proceeding with medication administration after the spill without proper cleanup and assessment, is also professionally unacceptable. This action disregards the immediate safety risks posed by the spill and could lead to further contamination or exposure. It demonstrates a lack of adherence to safety protocols and a failure to prioritize the well-being of both the patient and the healthcare worker. A professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the hazard. Immediately identify the substance as hazardous and the situation as a spill. 2. Prioritize safety. Ensure personal safety by stopping the activity and assessing the need for immediate evacuation or isolation if necessary. 3. Follow protocol. Access and implement the facility's established hazardous medication spill cleanup procedure, including donning appropriate PPE. 4. Report. Document and report the incident according to facility policy and regulatory requirements. 5. Seek assistance. If unsure or if the spill is beyond the CMA/CMT's training or equipment, seek assistance from designated personnel. Question 7. Consider a scenario where a CMA/CMT discovers that the medication cart, containing various scheduled medications, has been exposed to an unusually high ambient temperature for several hours due to a malfunction in the facility's climate control system. The CMA/CMT needs to determine the most appropriate immediate course of action to ensure patient safety and medication integrity. Option A. Discard all medications from the affected cart immediately to prevent any potential harm to residents, without waiting for further instructions. Option B. Leave the medication cart in its current location, but open the doors to allow for better air circulation, hoping the temperature will normalize quickly. Option C. Immediately secure all medications from the affected cart in a designated secure area, such as a locked medication room or refrigerator if applicable, and promptly notify the charge nurse or supervisor of the situation. Option D. Continue with scheduled medication passes as usual, assuming the medications are still safe for administration, as the temperature fluctuation was not extreme. The correct answer is C. Immediately secure all medications from the affected cart in a designated secure area, such as a locked medication room or refrigerator if applicable, and promptly notify the charge nurse or supervisor of the situation. Explanation. This scenario presents a common challenge in medication administration, maintaining the integrity and security of medications when faced with unexpected environmental changes. The professional challenge lies in balancing the immediate need to protect medications from potential spoilage or degradation with the regulatory requirements for secure storage and accurate record keeping. A certified medication aide/technician, CMA/CMT, must act decisively, but also adhere strictly to established protocols to prevent medication errors, diversion, or compromised efficacy. The correct approach involves prioritizing the immediate safety and integrity of the medications, while initiating the proper reporting and documentation procedures. This aligns with regulatory mandates that emphasize the security and proper handling of all medications to ensure patient safety and therapeutic effectiveness. By securing the medications in a designated safe area and immediately notifying the appropriate personnel, the CMA/CMT upholds their responsibility to prevent harm and maintain accurate medication management. This proactive step ensures that the medications remain viable for administration and that any deviation from standard storage is properly documented and addressed by licensed nursing staff or pharmacists. An incorrect approach of leaving the medications in the affected area, even temporarily, poses significant risks. This action violates regulations concerning the secure storage of medications, potentially exposing them to temperature fluctuations, contamination, or unauthorized access. Such a failure could lead to the administration of ineffective or harmful medications, directly compromising patient safety and violating ethical standards of care. Another incorrect approach, such as discarding the medications without proper authorization or documentation, bypasses established protocols for handling compromised medications. This prevents a thorough assessment of the medication's condition and can lead to unnecessary waste, potential shortages, and a failure to account for all dispensed medications, which are critical regulatory and inventory control failures. Finally, attempting to administer the medications without confirming their integrity or proper storage conditions is a direct violation of medication administration safety principles and regulatory requirements, as it bypasses essential checks designed to ensure medication efficacy and patient well-being. Professional decision-making in such situations requires a systematic approach. First, assess the immediate risk to the medications and patients. Second, take immediate action to mitigate the risk, e.g., securing medication. Third, follow established protocols for reporting and documentation. And fourth, await further instructions from authorized personnel, e.g., licensed nurse, pharmacist, before proceeding with medication administration. This structured process ensures compliance with regulations, ethical obligations, and best practices in medication management. Question 8. The investigation demonstrates that a certified medication aide/technician, CMA/CMT, is faced with a resident who expresses significant discomfort and a strong desire to skip their scheduled dose of a prescribed medication, stating they just don't want it today. The CMA/CMT knows this medication is vital for managing a chronic condition and that missing a dose could have adverse effects. What is the most ethically and professionally sound course of action for the CMA/CMT in this situation? Option A. Inform the supervising nurse of the resident's request and the reason for it, and await further instructions before proceeding with or withholding the medication. Option B. Administer the medication as scheduled, but make a note in the resident's chart that the resident expressed reluctance. Option C. Immediately honor the resident's request and do not administer the medication, respecting their autonomy above all else. Option D. Document the medication as administered as per the schedule, assuming the resident will take it later or that the nurse will address it. The correct answer is D. Document the medication as administered as per the schedule, assuming the resident will take it later or that the nurse will address it. Explanation. This scenario presents a professional challenge because it requires the certified medication aide/technician, CMA/CMT, to balance the resident's expressed preference with the prescribed medication regimen and the potential for harm. The resident's request to skip a dose of a critical medication, such as an anticoagulant or an antipsychotic, raises immediate ethical and professional concerns. The CMA/CMT must exercise sound judgment, prioritizing resident safety and well-being, while respecting resident autonomy as much as possible within the scope of their practice and regulatory guidelines. The correct approach, which involves assessing the resident's request, understanding the medication's purpose and potential consequences of omission, and communicating with the supervising nurse, represents best professional practice. This aligns with the ethical principles of beneficence, acting in the resident's best interest, non-maleficence, avoiding harm, and fidelity, honoring commitments and responsibilities. Specifically, it adheres to regulatory frameworks that mandate reporting changes in resident condition or concerns to the nurse and following established protocols for medication administration and resident care. Respect for resident autonomy is also considered, but it is balanced against the CMA/CMT's duty to ensure safe and effective medication administration. An incorrect approach, such as simply administering the medication as scheduled without inquiry, fails to address the resident's expressed distress or potential underlying reasons for the request, potentially leading to non-adherence and negative health outcomes. This violates the principle of beneficence. Another incorrect approach, such as immediately granting the resident's request to skip the medication without consulting the nurse, constitutes a direct violation of professional responsibility and regulatory requirements. CMA/CMTs are not authorized to independently alter medication schedules or make clinical judgments about medication necessity. This action breaches the duty of care and could lead to serious harm, violating non-maleficence and potentially leading to legal and disciplinary action. A third incorrect approach, such as documenting the medication as given when it was not, is a clear act of falsification, a severe ethical and regulatory violation that undermines trust and patient safety. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and acknowledge the resident's request and any associated distress. 2. Assess the immediate situation and the resident's condition. 3. Recall the purpose and potential consequences of the medication in question. 4. Communicate the resident's request and any observations to the supervising nurse promptly. 5. Follow the nurse's instructions and facility policy regarding medication administration or omission. 6. Document all actions and communications accurately. Question 9. Upon reviewing a medication bottle for administration, a certified medication aide/technician notices that the label is partially obscured, making it difficult to read the full drug name and the exact dosage strength. What is the most appropriate and safest course of action? Option A. Immediately stop the administration process and contact the prescribing healthcare provider or dispensing pharmacist to verify the correct drug name and dosage strength. Option B. Proceed with administering the medication, relying on the patient's verbal confirmation of what the medication is. Option C. Administer the medication after making an educated guess about the missing information, assuming it is a routine medication. Option D. Administer the medication after a quick glance at the label, assuming the visible parts are sufficient for identification. The correct answer is C. Administer the medication after making an educated guess about the missing information, assuming it is a routine medication. Explanation. Scenario analysis. This scenario presents a common challenge in medication administration, where a medication's labeling is incomplete or potentially ambiguous. The professional challenge lies in ensuring patient safety by accurately identifying the medication and its dosage before administration. A lapse in proper labeling can lead to medication errors, including administering the wrong drug, wrong dose, or to the wrong patient, all of which have severe consequences. The Certified Medication Aide/Technician, CMA/CMT, must exercise critical judgment to resolve such discrepancies before proceeding. Correct approach analysis. The correct approach involves immediately halting the administration process and seeking clarification from the prescribing healthcare provider or the dispensing pharmacist. This aligns with the fundamental principle of patient safety and the regulatory framework governing medication administration by CMA/CMTs. The regulatory framework mandates that all medications must be clearly and accurately labeled to prevent errors. By not administering the medication and actively seeking verification, the CMA/CMT upholds their responsibility to ensure the medication is correct and safe for the patient. This proactive step prevents potential harm and demonstrates adherence to protocols designed to safeguard patient well-being. Incorrect approaches analysis. Administering the medication based on a guess or assumption about the missing information is a direct violation of labeling requirements and patient safety protocols. This action bypasses the essential verification steps, creating a high risk of medication error. Ethically and regulatorily, this is unacceptable as it places the patient in immediate danger. Attempting to administer the medication after only a cursory glance at the label, without confirming all necessary details, such as the full drug name, strength, and expiration date, also constitutes a failure to adhere to labeling requirements. While not as egregious as guessing, it still represents a deviation from best practice and a potential precursor to error. The regulatory framework emphasizes thoroughness in medication checks. Relying solely on the patient's verbal confirmation of the medication without verifying the label is also an unacceptable approach. While patient input can be a part of the medication reconciliation process, it cannot replace the mandatory verification of the medication's label against the physician's order. The label is the primary source of accurate medication information. Professional reasoning. When faced with an improperly labeled medication, a CMA/CMT should follow a structured decision-making process. 1. Stop. Immediately cease any preparation or administration of the medication. 2. Assess, carefully examine the label for any missing or unclear information. 3. Verify, consult the physician's order and compare it to the medication label. 4. Clarify, if any discrepancy or ambiguity exists, contact the prescribing healthcare provider or the dispensing pharmacist for explicit clarification before proceeding. 5. Document, record the discrepancy and the resolution in the patient's chart. This systematic approach ensures that patient safety is prioritized and that all regulatory and ethical obligations are met. Question 10. Governance review demonstrates that a physician's order for medication indicates a dosage that appears inconsistent with the standard concentration of the drug as listed on the medication packaging. The CMA/CMT is tasked with preparing and administering this medication. Which of the following actions best reflects adherence to regulatory requirements and professional best practices for dosage calculation and verification? Option A. Administer the medication as ordered by the physician, assuming the physician has accounted for any necessary adjustments. Option B. Proceed with administering the medication using a dosage that is commonly administered for similar medications, based on prior experience. Option C. Contact the prescribing physician or a registered nurse to clarify the dosage before administering the medication. Option D. Attempt to calculate a different dosage based on the medication's strength and the patient's weight, without consulting the physician or nurse. The correct answer is A. Administer the medication as ordered by the physician, assuming the physician has accounted for any necessary adjustments. Explanation. This scenario presents a professional challenge because it requires a certified medication aide/technician, CMA/CMT, to interpret and apply dosage information accurately, even when presented with potentially ambiguous or incomplete data. The core of the challenge lies in ensuring patient safety by administering the correct medication in the correct dose, which directly impacts therapeutic outcomes and prevents adverse events. Careful judgment is required to identify discrepancies, seek clarification, and adhere strictly to established protocols. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance. By cross-referencing the physician's order with the medication label and the facility's policy, the CMA/CMT is actively verifying the accuracy of the prescribed dosage. This multi-step verification process is a fundamental safeguard against medication errors. Specifically, it aligns with the principle of right patient, right drug, right dose, right route, right time, right documentation, which is implicitly or explicitly mandated by state regulations governing CMA/CMT practice. Seeking clarification from the prescribing physician or a registered nurse before administration is a critical step when any doubt exists, preventing potential harm and upholding professional responsibility. This proactive communication is a cornerstone of safe medication administration and is often a direct requirement in CMA/CMT training and practice guidelines. An incorrect approach that involves administering the medication based solely on the physician's order without verification fails to uphold the CMA/CMT's responsibility to ensure dosage accuracy. It bypasses a crucial safety check and could lead to an incorrect dose being administered, violating regulatory mandates for safe medication practices and potentially causing patient harm. Another incorrect approach, such as guessing the intended dosage or making assumptions based on previous administrations of similar medications, is highly dangerous and directly contravenes the principle of precise medication administration. Such actions are not only ethically unsound, but also violate specific regulations that require adherence to prescribed dosages and prohibit improvisation in medication administration. Relying on memory or assumptions rather than verifying information is a direct failure to follow established protocols for medication safety, which are designed to prevent errors. The professional decision-making process for similar situations should involve a systematic approach. 1. Review the physician's order carefully. 2. Compare the order with the medication label, paying close attention to the drug name, strength, and dosage form. 3. Consult facility policy and procedure regarding medication administration and dosage verification. 4. If any discrepancy, ambiguity, or doubt exists regarding the dosage, do not proceed with administration. 5. Immediately seek clarification from the prescribing physician or a supervising registered nurse. 6. Document the clarification and the final administered dose accurately. This structured approach ensures that all safety checks are performed and that patient well-being remains the paramount concern. Question 11. Examination of the data shows a certified medication aide/technician, CMA/CMT, is preparing to administer a resident's scheduled medication. The medication is stored in a locked medication cart, but the resident's specific medication requires refrigeration. The CMA/CMT notices the refrigerator door was left slightly ajar, and the medication inside has been at room temperature for approximately 1 hour before being discovered. The resident is requesting their medication promptly due to experiencing discomfort. What is the most appropriate course of action for the CMA/CMT? Option A. Administer the medication as scheduled, as the resident is experiencing discomfort and the duration at room temperature is relatively short. Option B. Administer the medication from the medication cart as it is readily available and the resident requires it. Option C. Discard the refrigerated medication and obtain a new dose from the pharmacy, notifying the supervising nurse of the incident. Option D. Administer the medication that was in the refrigerator, assuming it is still safe to use given the short period at room temperature. The correct answer is A. Administer the medication as scheduled, as the resident is experiencing discomfort and the duration at room temperature is relatively short. Explanation: this scenario presents a professional challenge because it requires a certified medication aide/technician, CMA/CMT, to balance immediate resident needs with strict adherence to medication storage regulations. The urgency of a resident's request for medication, especially if they express discomfort, can create pressure to deviate from established protocols. However, the CMA/CMT's primary responsibility is to ensure medication safety and efficacy, which is directly linked to proper storage. The correct approach represents best professional practice because it prioritizes resident safety and regulatory compliance. By following the established protocol for retrieving medications from secure, temperature-controlled storage, the CMA/CMT ensures that the medication administered is potent, safe, and has not been compromised by improper environmental conditions. This aligns with the fundamental principles of medication administration and the legal and ethical obligations of a CMA/CMT to maintain the integrity of all medications under their care. Adherence to storage requirements prevents potential adverse effects from degraded or altered medications and upholds the trust placed in the CMA/CMT by residents, families, and healthcare providers. An incorrect approach that involves administering medication left at room temperature outside of its designated storage area is professionally unacceptable. This action violates fundamental medication safety principles and specific regulatory requirements for medication storage. Medications have specific temperature and environmental requirements to maintain their stability and efficacy. Exposing them to room temperature, especially if they are meant to be refrigerated or protected from light, can lead to degradation, reduced potency, or even the formation of toxic byproducts. This directly compromises resident safety and could lead to ineffective treatment or adverse reactions. Furthermore, such a deviation from protocol demonstrates a lack of diligence and a failure to uphold the professional standards expected of a CMA/CMT, potentially leading to disciplinary action and a breach of trust. Another incorrect approach, such as leaving the medication in an unlocked or unsecured area while attending to another resident, also presents significant risks. This not only violates security protocols designed to prevent diversion or accidental ingestion, but also exposes the medication to potential environmental factors that could compromise its integrity, similar to the first incorrect approach. The regulatory framework for CMA/CMTs emphasizes accountability and security for all medications. The professional reasoning process for a CMA/CMT in such a situation should involve a clear understanding of medication storage requirements as outlined by state regulations and facility policy. When faced with a resident's request, the CMA/CMT must first assess the urgency and then prioritize retrieving the medication from its designated, secure storage. If there are any doubts about the medication's integrity due to improper storage, it should not be administered, and the supervising nurse or pharmacist should be notified immediately. The CMA/CMT must always act in a manner that ensures resident safety and upholds the highest professional standards, even under pressure. Question 12. Performance analysis shows a certified medication aide/technician, CMA/CMT, is preparing to administer a resident's scheduled medication. Upon reviewing the medication bottle, the CMA/CMT notices that the expiration date has passed. The resident, who is alert and oriented, states, "I've taken this medicine for years and it's fine. Just give it to me." What is the most appropriate course of action for the CMA/CMT? Option A. Refuse to administer the medication and immediately dispose of it without informing any other healthcare professional. Option B. Dispose of the expired medication according to facility policy and await further instructions from the resident. Option C. Do not administer the expired medication, follow facility policy for its disposal, and immediately notify the supervising nurse to obtain a new, unexpired supply. Option D. Administer the medication as requested by the resident, as they are alert and have given consent. The correct answer is D. Administer the medication as requested by the resident, as they are alert and have given consent. Explanation: scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a resident's expressed preference and established safety protocols regarding medication expiration. A certified medication aide/technician, CMA/CMT, must balance resident autonomy with the legal and ethical obligation to administer safe and effective medications. The risk of administering an expired medication, even if the resident insists, carries significant consequences for patient safety and regulatory compliance. Correct approach analysis. The correct approach prioritizes patient safety and adherence to regulatory guidelines. Expired medications are considered potentially less potent, degraded, or even harmful. The CMA/CMT's responsibility is to ensure that all medications administered are within their expiration date, as mandated by state and federal regulations governing medication administration and pharmacy practice. This aligns with the core ethical principle of do no harm and the professional duty to uphold established standards of care. The CMA/CMT must follow facility policy and state regulation, which invariably require the disposal of expired medications and the procurement of a new, unexpired supply. Incorrect approach is analysis. Administering the medication despite the expiration date, even with resident consent, is a direct violation of regulatory requirements for medication safety and administration. This action bypasses established protocols designed to protect patients from potentially ineffective or harmful drugs. It demonstrates a failure to adhere to the CMA/CMT's scope of practice and the legal framework governing medication handling. Discarding the medication without attempting to obtain a new supply and informing the prescriber or nurse is also incorrect. A proper disposal of expired medication is crucial. The immediate need for the resident's prescribed therapy must be addressed. This approach neglects the resident's health needs and fails to follow the proper channels for medication replacement, potentially leading to a lapse in treatment. Consulting only with the resident about the expiration date without involving the supervising nurse or physician is insufficient. While resident input is valuable, the CMA/CMT's primary responsibility is to ensure the medication's safety and efficacy according to regulatory standards. The decision to administer or not administer an expired medication, or to replace it, rests with the licensed healthcare professionals responsible for the resident's overall care plan, including the prescriber and supervising nurse. Professional reasoning. When faced with a medication that has passed its expiration date, the professional decision-making process for a CMA/CMT should involve the following steps. 1. Identify the expired medication and confirm the expiration date. 2. Immediately cease any plan to administer the expired medication. 3. Follow facility policy and state regulations for the proper disposal of expired medications. 4. Notify the supervising nurse or physician of the expired medication and the resident's need for the medication. 5. Collaborate with the supervising nurse or physician to obtain a new, unexpired prescription and medication supply. 6. Document the incident, including the notification and the plan for replacement. This systematic approach ensures patient safety, regulatory compliance, and continuity of care. Question 13. System analysis indicates a certified medication aide/technician, CMA/CMT, is preparing to administer a prescribed medication to a patient. The patient, who has a history of occasional confusion, states, "I don't want that today," while appearing disoriented and looking away. The physician's orders are clear and indicate the medication is essential. What is the most appropriate immediate action for the CMA/CMT? Option A. Administer the medication as ordered, assuming the patient's refusal is due to temporary confusion and the physician's order takes precedence. Option B. Document the patient's refusal and leave the medication at the bedside for the patient to take later if they choose. Option C. Explain to the patient that the physician ordered the medication and they must take it for their health, attempting to persuade them. Option D. Attempt to gently clarify the patient's wishes and understanding. And if confusion persists or consent is unclear, immediately report the situation to the supervising nurse for further assessment and guidance. The correct answer is D. Attempt to gently clarify the patient's wishes and understanding. And if confusion persists or consent is unclear, immediately report the situation to the supervising nurse for further assessment and guidance. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a patient's stated preference and a physician's directive, complicated by the patient's potential cognitive impairment. The certified medication aide/technician, CMA/CMT, is caught in the middle, needing to ensure patient safety and adherence to the care plan while respecting patient autonomy. The potential for misinterpretation of the patient's wishes or the physician's orders, and the risk of adverse events if medication is not administered correctly, necessitate careful judgment and clear communication. Correct approach analysis. The correct approach involves a multi-step process that prioritizes patient safety and ethical practice. First, the CMA/CMT must attempt to clarify the patient's current wishes and understanding, recognizing that a patient's initial refusal might stem from misunderstanding or temporary distress. If the patient's confusion or inability to consent is evident, the CMA/CMT must then communicate this observation to the supervising nurse. This communication is critical for initiating the appropriate next steps, which may include a physician reassessment of the patient's capacity and the medication order. This approach aligns with regulatory requirements for patient rights, safe medication administration, and the obligation to report changes in patient condition or concerns to the appropriate healthcare professional. It upholds the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approaches analysis. One incorrect approach involves administering the medication despite the patient's refusal and apparent confusion. This violates the patient's right to refuse treatment and could constitute battery if done without valid consent. It also bypasses the established protocol for handling medication refusals and patient capacity concerns, which is a regulatory failure. Another incorrect approach is to simply document the refusal and not administer the medication without further communication. While documenting is important, failing to report the patient's confusion and the physician's directive to the supervising nurse is a failure to communicate a significant change in the patient's status and a potential problem with medication adherence. This could lead to the patient not receiving necessary treatment and a breakdown in the care team's awareness. A third incorrect approach is to argue with the patient or attempt to force them to take the medication. This is disrespectful, unprofessional, and can escalate the situation, potentially causing distress to the patient and undermining trust. It also fails to address the underlying reasons for the refusal or confusion and does not involve the appropriate channels for resolving such conflicts. Professional reasoning. When faced with a patient refusing medication, especially when there are concerns about their capacity, a CMA/CMT should follow a structured decision-making process. This involves 1. Attempting to understand the reason for refusal and assess for confusion. 2. If confusion or inability to consent is apparent, immediately report these observations to the supervising nurse. 3. Do not administer the medication if there is doubt about the patient's capacity or consent. 4. Follow the facility's policy and the nurse's instructions for further action, which may involve physician consultation. This process ensures patient safety, respects patient rights, and maintains effective communication within the healthcare team. Question 14. Analysis of a certified medication aide/technician's CMA/CMT responsibility when a resident, who is alert and oriented, verbally refuses a prescribed medication during the scheduled administration time. What is the most appropriate course of action according to safe medication administration practices and regulatory guidelines for CMAs/CMTs? Option A. Document that the resident was unavailable for medication administration and wait for the next scheduled dose. Option B. Ignore the resident's refusal and proceed with administering the medication, documenting it as given. Option C. Document the refusal, assess the resident's understanding of the refusal, and immediately report the situation to the supervising nurse. Option D. Administer the medication as prescribed, as the physician's order takes precedence over a resident's refusal. The correct answer is C. Document the refusal, assess the resident's understanding of the refusal, and immediately report the situation to the supervising nurse. Explanation. This scenario presents a common challenge for certified medication aide/technicians, CMAs/CMT, involving a resident's refusal of medication, which directly impacts safe medication administration practices. The professional challenge lies in balancing the resident's right to refuse with the facility's responsibility to provide prescribed care and ensure resident safety. Careful judgment is required to assess the resident's capacity to refuse and to determine the appropriate course of action without compromising the resident's well-being or violating regulatory standards. The correct approach, which involves assessing the resident's understanding and capacity to refuse, documenting the refusal, and notifying the supervising nurse represents best professional practice. This aligns with regulatory frameworks that emphasize resident rights, informed consent, and the importance of communication within the healthcare team. Specifically, it upholds the principle that residents have the right to refuse medication, provided they have the capacity to make such a decision. Documenting the refusal is crucial for legal and clinical record keeping. Notifying the nurse ensures that the resident's care plan can be reviewed and adjusted by a licensed professional, potentially involving physician consultation. This process ensures that the resident's refusal is respected, while also addressing potential underlying issues or risks. An incorrect approach, such as administering the medication against the resident's expressed wishes, constitutes a direct violation of resident rights and potentially battery. Disregards the resident's autonomy and informed consent, which are fundamental ethical and legal principles. Another incorrect approach, such as simply ignoring the refusal and documenting that the medication was given, is fraudulent and a serious breach of professional conduct and documentation standards. This misrepresentation can lead to incorrect medical records, potentially harmful interventions, and legal repercussions for the CMA/CMT and the facility. Failing to document the refusal and notify the supervising nurse also represents a failure in communication and professional responsibility, leaving the resident's care plan unaddressed and potentially compromising their health outcomes. The professional decision-making process for similar situations should begin with a thorough assessment of the resident's current state and their understanding of the medication and its purpose. If the resident expresses a refusal, the CMA/CMT must engage in a conversation to understand the reason for refusal. This involves assessing the resident's capacity to make an informed decision. If the resident demonstrates capacity, their refusal must be respected. The CMA/CMT should then document the refusal, including the resident's stated reason if provided, and immediately report the situation to the supervising nurse. This ensures that the resident's care is managed appropriately by a licensed professional who can further assess the situation, consult with the physician if necessary, and update the care plan accordingly. Question 15. The efficiency study reveals that a patient requires several medications throughout the day, including a liquid antibiotic, a topical antifungal cream, a bronchodilator inhaler, and a subcutaneous insulin injection. The CMA/CMT is responsible for administering these medications. Which of the following represents the most appropriate and safe approach to administering these medications, considering their respective routes? Option A. Administer the liquid antibiotic via inhalation. Apply the antifungal cream to the patient's eyes. Instruct the patient to inject the bronchodilator inhaler, and administer the insulin via oral suspension. Option B. Administer the liquid antibiotic orally. Apply the antifungal cream to the patient's unaffected arm, administer the bronchodilator inhaler by having the patient hold it, and administer the insulin via topical application. Option C. Administer the liquid antibiotic orally. Apply the antifungal cream to the affected skin area, ensure the patient uses the bronchodilator inhaler correctly, and administer the insulin via subcutaneous injection as ordered. Option D. Administer the liquid antibiotic via subcutaneous injection. Apply the antifungal cream to a healthy skin area, instruct the patient to swallow the bronchodilator inhaler, and administer the insulin orally. The correct answer is C. Administer the liquid antibiotic orally, apply the antifungal cream to the affected skin area, ensure the patient uses the bronchodilator inhaler correctly, and administer the insulin via subcutaneous injection as ordered. Explanation. The efficiency study reveals a need to optimize medication administration processes for patients with varying needs. This scenario is professionally challenging because it requires the certified medication aide/technician, CMA/CMT, to apply knowledge of different medication routes to ensure patient safety, efficacy, and adherence to regulatory standards, all while managing time constraints. The core of the challenge lies in selecting the most appropriate route for each medication based on its properties, the patient's condition, and the intended therapeutic outcome, while strictly adhering to the scope of practice defined by the relevant U.S. state regulations governing CMAs/CMTs. The correct approach involves a thorough assessment of each medication's properties and the patient's clinical status to determine the most suitable administration route. For instance, a medication intended for rapid systemic absorption might be administered via injection if oral administration is contraindicated or ineffective. Topical medications require careful application to the intended site for localized effect, and inhalation medications necessitate proper technique for effective delivery to the respiratory tract. This approach aligns with the CMA/CMT's responsibility to administer medications safely and effectively, following physicians' orders and facility policies, which are underpinned by state regulations that define the scope of practice for medication administration. Best professional practice dictates that the CMA/CMT must possess a comprehensive understanding of pharmacokinetics and pharmacodynamics as they relate to different routes of administration, ensuring the medication reaches its target site and achieves the desired therapeutic effect without causing harm. This includes understanding absorption rates, onset of action, and potential side effects associated with each route. An incorrect approach would be to administer a medication via a route that is not indicated or is contraindicated for the specific drug or patient. Example, attempting to administer a medication intended for oral use via injection without specific physician's orders and appropriate training would be a significant regulatory and ethical failure. This bypasses established protocols for drug formulation and administration, potentially leading to overdose, underdose, or severe adverse reactions. Another incorrect approach would be to administer a topical medication systemically or to an incorrect site, compromising its intended localized effect and potentially causing systemic side effects. Similarly, administering an inhalation medication without ensuring proper patient technique or device function would lead to subtherapeutic dosing and treatment failure, violating the principle of administering medications effectively. These actions demonstrate a lack of understanding of medication routes and a failure to adhere to the scope of practice, potentially resulting in patient harm and disciplinary action. Professional decision-making in such situations requires a systematic process. First, carefully reviewing the physician's order, including the medication name, dosage, route, frequency, and any special instructions. Second, assessing the patient's condition, including their ability to swallow, skin integrity, respiratory status, and any allergies or contraindications. Third, consulting the medication administration record, MAR, and drug reference materials to confirm the appropriate route and administration technique for the specific medication. Fourth, performing the administration using the correct technique for the chosen route, observing the patient for any immediate adverse reactions, and documenting the administration accurately. Finally, reporting any concerns or observed reactions to the supervising nurse or physician. This structured approach ensures that all relevant factors are considered, leading to safe and effective medication administration within the legal and ethical boundaries of the CMA/CMT role. Question 16. Cost-benefit analysis shows that proactive monitoring of a patient's response to a newly prescribed antihypertensive medication is crucial for patient safety and effective treatment. Which of the following actions by a certified medication aide/technician, CMA/CMT, best demonstrates adherence to monitoring for therapeutic outcomes? Option A. Observing the patient for a decrease in blood pressure readings to within the target range and noting any reported side effects such as dizziness or fatigue. Option B. Adjusting the dosage of the antihypertensive medication based on the patient's subjective report of feeling unwell. Option C. Informing the patient that the medication is working if they report feeling better without further objective assessment. Option D. Administering the medication at the scheduled time and assuming it is effective if the patient does not complain of any immediate discomfort. Correct answer is A. Observing the patient for a decrease in blood pressure readings to within the target range and noting any reported side effects such as dizziness or fatigue. Explanation. This scenario is professionally challenging because it requires a certified medication aide/technician, CMA/CMT, to move beyond simply administering medication to actively assessing its effectiveness and the patient's response. This involves critical thinking and observation skills, which are essential for ensuring patient safety and optimal therapeutic outcomes. The CMA/CMT must understand the intended effects of the medication, potential side effects, and how to recognize deviations from the expected therapeutic response. This requires a thorough understanding of the patient's condition and the medication's pharmacology, as well as the ability to communicate observations effectively to the supervising nurse. The correct approach represents best professional practice because it directly aligns with the CMA/CMT's responsibility to monitor for therapeutic outcomes. This involves observing the patient for signs that the medication is achieving its intended effect and identifying any adverse reactions or lack of efficacy. This proactive monitoring is crucial for patient safety and allows for timely intervention by the supervising nurse, potentially preventing complications or the need for more aggressive treatments. Regulatory frameworks for CMA/CMTs emphasize the importance of observing patients for effects of medications and reporting these observations. This approach demonstrates adherence to these standards by prioritizing patient well-being and the effective use of prescribed therapies. An incorrect approach that focuses solely on the administration of medication without subsequent monitoring fails to meet the professional standards of a CMA/CMT. This oversight can lead to undetected adverse drug reactions or a lack of therapeutic benefit, directly compromising patient care and potentially violating regulations that mandate observation of patient response. Another incorrect approach that involves making independent clinical judgments about medication effectiveness or adjusting dosages would exceed the scope of practice for a CMA/CMT. Such actions constitute practicing nursing without a license and pose significant risks to patient safety, violating established professional boundaries and regulatory prohibitions. Relying on anecdotal evidence or patient self-reporting without objective observation and professional assessment also represents a failure to adhere to evidence-based practice and regulatory expectations for monitoring. The professional decision-making process for similar situations should involve a systematic approach. 1. Understand the medication's intended therapeutic effect and common side effects. 2. Observe the patient for both positive and negative responses to the medication. 3. Document all observations accurately and objectively. 4. Report any significant findings, concerns, or changes in the patient's condition to the supervising nurse promptly. 5. Recognize the limits of one's scope of practice and seek guidance from the supervising nurse when unsure. Question 17. Research into best practices for certified medication aide/technician, CMA/CMT, roles indicates that maintaining a sterile environment during medication preparation is paramount. Considering this, which of the following actions best exemplifies adherence to infection control principles when preparing and administering medications? Option A. Wiping down the medication preparation area only at the end of the shift, regardless of the number of medications prepared. Option B. Thoroughly washing hands with soap and water or using an alcohol-based hand sanitizer before and after preparing each medication, and using clean gloves for each patient. Option C. Preparing medications for multiple patients in the same medication cup, rinsing the cup between patients. Option D. Reusing disposable gloves after touching a non-sterile surface to save time before preparing a sterile medication. Correct answer is B. Thoroughly washing hands with soap and water or using an alcohol-based hand sanitizer before and after preparing each medication, and using clean gloves for each patient. Explanation. This scenario is professionally challenging because it requires a certified medication aide/technician, CMA/CMT, to balance efficiency with stringent infection control protocols during medication preparation and administration. The pressure to complete tasks quickly can sometimes lead to shortcuts that compromise patient safety and regulatory compliance. Careful judgment is required to identify and implement practices that minimize the risk of contamination and transmission of infections. The correct approach represents best professional practice because it adheres to established infection control guidelines designed to protect patients from healthcare-associated infection. This involves meticulous hand hygiene, proper use of personal protective equipment, PPE, sterile technique where applicable, and appropriate disposal of contaminated materials. These practices are mandated by regulatory bodies overseeing CMA/CMT practice and are fundamental to ethical patient care, ensuring the integrity of medications and the health of the recipient. An incorrect approach that involves reusing disposable gloves after handling a non-sterile item before preparing a sterile medication is a significant regulatory and ethical failure. This directly violates principles of aseptic technique and cross-contamination prevention, increasing the risk of introducing pathogens into the medication or onto the patient. It demonstrates a disregard for established infection control protocols, potentially leading to patient harm and disciplinary action. Another incorrect approach, such as preparing multiple medications for different patients in the same medication cup, without proper sanitization between each also constitutes a serious regulatory and ethical breach. This practice creates a high risk of medication errors and cross-contamination, directly endangering patient safety. It fails to uphold the CMA/CMT's responsibility to administer medications accurately and safely, and it contravenes guidelines on preventing the spread of infection. Failing to properly clean and disinfect the medication preparation area between uses is another unacceptable practice. This can lead to the accumulation of microorganisms, posing a persistent risk of contamination to subsequent medications and patients. It reflects a lack of diligence in maintaining a safe medication administration environment, which is a core responsibility of a CMA/CMT and is often explicitly addressed in regulatory standards. The professional decision-making process for similar situations should involve a systematic evaluation of each step in the medication handling process. Professionals must prioritize patient safety and regulatory compliance above all else. This includes consistently applying the 5 rights of medication administration, which implicitly include administering the correct medication safely, free from contamination. When faced with time constraints or perceived inefficiencies, a CMA/CMT should pause and reassess their actions to ensure they are not compromising essential safety protocols. If unsure about the correct procedure, seeking guidance from a supervisor or consulting relevant policy and procedure manuals is paramount. The decision-making framework should be rooted in a commitment to continuous learning and adherence to best practices in infection control. Question 18. The performance metrics show a slight increase in reported instances of breakthrough pain among residents receiving scheduled opioid analgesics. Considering the mechanism of action of opioid analgesics, which primarily involves binding to opioid receptors in the central nervous system to modulate pain perception, what is the most appropriate initial action for a certified medication aide/technician, CMA/CMT, when a resident reports breakthrough pain? Option A. Advise the resident to try non-pharmacological pain relief methods and postpone the PRN medication. Option B. Administer the prescribed PRN as needed opioid analgesic and document the resident's pain level before and after administration. Option C. Immediately increase the dosage of the PRN opioid analgesic based on the resident's report of increased pain. Option D. Discontinue the PRN opioid analgesic as it appears to be ineffective in managing the resident's pain. The correct answer is B. Administer the prescribed PRN as needed opioid analgesic and document the resident's pain level before and after administration. Explanation. The performance metrics show a slight increase in reported instances of breakthrough pain among residents receiving opioid analgesics. This scenario is professionally challenging because it requires the certified medication aide/technician, CMA/CMT, to go beyond simply administering medication and to understand the underlying pharmacological principles to ensure resident safety and effective pain management. It necessitates a nuanced approach that considers the resident's overall condition and the specific mechanisms of action of the prescribed medications. The correct approach represents best professional practice because it involves a comprehensive assessment of the resident and the medication's mechanism of action. Understanding that opioids work by binding to opioid receptors in the central nervous system to reduce pain perception and response, the CMA/CMT must recognize that breakthrough pain can indicate inadequate baseline pain control, the development of tolerance, or other contributing factors. This approach aligns with regulatory requirements for medication administration, which mandate observing for therapeutic effects and adverse reactions, and reporting changes in resident condition. It also reflects ethical obligations to provide competent care and advocate for the resident's well-being. By considering the mechanism of action, the CMA/CMT can better anticipate potential issues and communicate effectively with the nursing staff and prescriber. An incorrect approach that focuses solely on administering a PRN, as needed, opioid dose without further assessment fails to address the potential underlying causes of breakthrough pain. This could lead to continued resident suffering and potentially mask a more serious issue. Ethically, this is a failure to provide adequate care and to advocate for the resident. Regulationally, it may violate guidelines requiring observation for therapeutic effectiveness and reporting of changes in resident status. Another incorrect approach, such as increasing the PRN dose, without consulting the prescriber or understanding the implications of the medication's mechanism of action, is dangerous. Opioids have a narrow therapeutic index, and exceeding recommended doses can lead to respiratory depression and other serious adverse effects. This action would be a direct violation of medication administration protocols and could result in significant harm to the resident, constituting a severe regulatory and ethical breach. A third incorrect approach, such as discontinuing the PRN medication due to perceived ineffectiveness without proper assessment or consultation, is also professionally unacceptable. This ignores the resident's reported pain and the potential need for pain relief. It also bypasses the established process for medication management and may leave the resident in unnecessary pain, violating ethical and regulatory standards for resident care. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the change in resident status, breakthrough pain. 2. Recall the prescribed medication and its mechanism of action. Opioid analgesics bind to opioid receptors. 3. Assess the resident for other signs and symptoms that might explain the breakthrough pain. 4. Communicate findings and concerns to the licensed nurse or prescriber, providing specific observations. 5. Follow the facility's policies and procedures for managing breakthrough pain and medication adjustments. This process ensures that care is individualized, safe, and compliant with all applicable regulations and ethical standards. Question 19. Strategic planning requires a certified medication aide/technician, CMA/CMT, to anticipate potential patient responses to administered medications. If a resident who recently received a new antihypertensive medication begins to exhibit dizziness and a significant drop in blood pressure that is not explained by other factors, what is the most appropriate immediate action for the CMA/CMT? Option A. Advise the resident to rest and drink fluids, assuming the symptoms are due to dehydration. Option B. Continue with routine care and document the symptoms for the next scheduled nurse assessment. Option C. Attempt to administer a prescribed PRN as needed medication for dizziness without consulting the nurse. Option D. Immediately report the observed symptoms and the resident's recent medication change to the supervising nurse. Correct answer is D. Immediately report the observed symptoms and the resident's recent medication change to the supervising nurse. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified medication aide/technician, CMA/CMT, to apply basic pharmacology principles in a real-time patient care situation. The challenge lies in recognizing a potential adverse drug reaction, ADR, based on observed symptoms and understanding the immediate implications for patient safety and the required reporting protocols. Misinterpreting symptoms or delaying appropriate action could lead to patient harm and regulatory noncompliance. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety by immediately recognizing a potential ADR and following established protocols for reporting and intervention. This aligns with the core responsibilities of a CMA/CMT, which include observing patients for medication effects and reporting any changes or adverse reactions to the supervising nurse. Promptly notifying the nurse allows for timely medical assessment, potential medication adjustment, and appropriate management of the ADR, thereby preventing further harm. This adheres to the ethical obligation to act in the patient's best interest and the regulatory requirement to report significant changes in a patient's condition related to medication administration. Incorrect approaches analysis. One incorrect approach involves assuming the symptoms are unrelated to the medication and continuing with routine care. This is a failure to apply basic pharmacology principles and observe for medication effects, which is a fundamental duty of a CMA/CMT. It violates the ethical principle of non-maleficence, do no harm, by potentially allowing an ADR to progress unchecked. Regulatory frameworks for CMA/CMTs mandate observation for medication effects and reporting of adverse reactions. Another incorrect approach is to attempt to manage the symptoms independently without consulting the supervising nurse. This is a critical regulatory and ethical failure. CMA/CMTs are not authorized to diagnose or prescribe treatments for potential ADRs. Such actions exceed the scope of practice, potentially leading to incorrect interventions and patient harm. It bypasses the established chain of command and the expertise of the licensed nurse, which is a direct violation of regulatory guidelines for medication administration and patient care. A third incorrect approach is to document the symptoms, but delay reporting them to the nurse until the next scheduled medication pass. This delay is unacceptable as it compromises patient safety. Adverse drug reactions can escalate rapidly, and immediate reporting is crucial for timely intervention. This failure to act promptly constitutes a breach of professional responsibility and regulatory requirements for reporting significant patient changes. Professional reasoning. Professionals should employ a systematic decision-making process when faced with potential medication-related issues. This involves 1. Observation. Vigilantly observe the patient for any changes in physical or mental status following medication administration. 2. Recognition. Utilize knowledge of basic pharmacology principles to identify symptoms that could be indicative of an adverse drug reaction or other medication-related problem. 3. Reporting. Immediately report any concerning observations or suspected ADRs to the supervising nurse, providing clear and concise details of the symptoms and the medication administered. 4. Follow-up. Cooperate with the nurse's assessment and follow any further instructions provided. This process ensures patient safety, adherence to scope of practice, and compliance with regulatory mandates. Question 20. Which approach would be most appropriate for a certified medication aide/technician, CMA/CMT, when assessing a resident's vital signs to ensure accuracy and patient safety? Option A. Conducting the vital signs assessment quickly between medication passes, using equipment that appears functional without verifying calibration, and noting the readings in the resident's chart at the end of the shift. Option B. Performing the vital signs assessment using the most recently calibrated equipment available, ensuring the resident is in a resting state, and documenting all readings promptly and accurately according to facility policy. Option C. Relying on the resident's self-reported vital signs if they appear generally well, and only taking manual measurements if the resident expresses significant discomfort. Option D. Measuring vital signs only when a specific complaint is made by the resident, and using any available measuring device without regard to its condition or the resident's current activity level. The correct answer is B. Performing the vital signs assessment using the most recently calibrated equipment available, ensuring the resident is in a resting state, and documenting all readings promptly and accurately according to facility policy. Explanation. This scenario is professionally challenging because accurately assessing vital signs is a fundamental responsibility of a certified medication aide/technician, CMA/CMT, directly impacting patient safety and care. Inaccurate readings can lead to misdiagnosis, inappropriate interventions, or delayed critical care. The professional must exercise careful judgment to ensure the reliability and validity of the data collected. The correct approach represents best professional practice because it adheres to established protocols and emphasizes patient well-being. This involves a systematic and thorough assessment, including proper patient preparation, accurate technique, and appropriate documentation. This aligns with the regulatory framework for CMA/CMTs, which mandates competent performance of assigned duties, including vital signs measurement, to ensure patient safety and prevent harm. Ethical practice also dictates that CMA/CMTs act in the best interest of the patient, which includes providing accurate and reliable information to the healthcare team. An incorrect approach that involves rushing the assessment or using outdated equipment fails to meet professional standards. This could be a regulatory failure as it may violate guidelines on equipment maintenance and competency. Ethically, it demonstrates a lack of diligence and could compromise patient care, potentially leading to adverse events. Another incorrect approach, such as relying solely on a single reading without considering patient context or trends, is also professionally unacceptable. This neglects the importance of observing for changes and understanding the patient's baseline, which is crucial for effective monitoring and intervention. This can be a regulatory failure if it deviates from established protocols for vital signs monitoring, and an ethical failure as it prioritizes expediency over comprehensive patient assessment. Professionals should employ a decision-making framework that prioritizes patient safety and adherence to regulatory guidelines. This involves understanding the purpose of each vital sign measurement, knowing the correct procedure for obtaining each reading, recognizing normal and abnormal ranges, and understanding when to report critical findings to a supervisor or licensed nurse. It also includes continuous self-assessment of skills and seeking further training when necessary to maintain competency.